Now to the latest on a social media weight loss craze. It's called Berberine. Some folks are saying it's nature's Ozempic. It's a dietary supplement that's taking the internet by storm because some users claim it can actually reduce your appetite and help you drop pounds. The supplement, popular with those who are looking for a cheaper alternative to weight loss drugs. But just how effective is Berberine? We brought in senior medical correspondent Dr. John Torres to answer that question. So first of all, Dr. John, what is it and what about this claim that folks are making on the internet? Any legitimacy to that?
So Berberine is a natural supplement. It's been around since around 1917 when originally it was used as a dye, and then so they found out it had some medicinal benefits. And there are a few things we think it works for. Cholesterol seems to be able to lower cholesterol. Blood sugars, it can help maintain blood sugar. And because of the social media craze, people are starting
remedies out there that create effects, okay? Maybe multiple effects, but berberine takes it to the next level. Berberine is a chemical that comes from different plants, and it's most known for its effect on blood sugars, lowering your blood sugars, helping to make insulin more sensitive, attacking insulin resistance, okay, which, by the way, is at the heart of most health problems, including a fatty liver, high blood pressure, high triglycerides, including oxidative LDL, which actually creates a lot of damage on the inside layer of your heart. And berberine has a very powerful, potent effect directly on the interior wall of your arteries called the endothelial layer. So it can suppress that oxidation that's happening, that's creating plaquing. So it actually helps shrink plaquing. And anything that helps insulin resistance is going to shrink your midline, your weight circumference. Berberine has antithrombotic effects. It improves the symptoms of Alzheimer's, which is type 3 diabetes. And it greatly improves the dawn phenomena, where you would wake up in the morning with your blood sugars too high because you have severe insulin resistance, which is really a problem with gluconeogenesis, which is the production of new glucose from other things like protein and fats. Just think about a diabetic, right? They have high blood glucose. And you might think that the only reason their blood sugars are high is because they're eating too many carbs. But that's not 100% true. One big reason why their blood sugar is high is because their liver is making a lot of new sugar. It's called gluconeogenesis because their insulin resistance is so bad. And this is why berberine is equivalent to metformin, okay, the main medication they use in type 2 diabetes, but without the toxic effects. Now let's get into some other things that berberine can do. It can activate vitamin D conversion to the active form. When you take vitamin D or you're converting sunlight in your skin level, or you're converting your own vitamin D from the sun, it has to be converted to the active form. Well, guess what? Berberine helps that conversion. Berberine helps prevent cardiac muscle fibrosis from occurring after a heart attack or any type of damage involving a lack of oxygen called ischemia. So it's very protective against the cardiac muscles from getting this scar tissue. Berberine is also neuroprotective. If there is toxicity in the neurons, berberine can help protect the neurons. Berberine has a really fascinating effect with neurotransmitters too. I'm talking about dopamine, talking about serotonin, noradrenaline in the hippocampus. So it has a direct improvement on your mood, increasing your mood from depression or anxiety to a normal mood. Berberine even helps the withdrawal side effects from coming off of a drug. Berberine is also very antimicrobial, antiviral, antibacterial, as well as having a capacity to improve your immune system, specifically your T cells. But out of all that, the real cool thing about berberine is it can actually reverse mitochondrial damage, improving more oxygen consumption, ATP production, electron chain transport, which basically is the conversion of fuel to ATP and all the different stages that occur. It's like the assembly line in the machine in the mitochondria that helps you make energy, as well as increasing the number of mitochondria. But other than that, I don't think berberine has any other positive effects that I can think of.
Today we're going to talk about berberine, okay? Berberine is the next turmeric, okay? It is actually incredible. It's been thoroughly studied. A lot of people know about it, but they don't know all the different things it can do. Some hardcore research on a lot of things, especially the cardiovascular system. It's a very powerful antiarrhythmic natural compound. Now, berberine is a phytonutrient in certain plants, okay? So it's not necessarily a name of a plant. And because the mechanism of arrhythmias involve calcium, berberine can decrease the intracellular calcium, which is one actual cause of the heart going out of rhythm, because calcium is an electrolyte. If there's too much calcium in the cell, it becomes toxic and it affects the electrical system of the heart. It can also decrease blood pressure. It can increase the performance of the actual heart muscle itself. It decreases the risk of heart attacks, protects against ischemia in heart muscle. This is a lack of oxygen. If there's some type of obstruction because there's a clogged artery that's causing a lack of blood flow to the heart muscle, this can help it. Also, it can alter potassium channels. Now, potassium is a mineral that protects excessive amounts of calcium going into the cell. And this is why certain arrhythmias are actually caused by low potassium. Because if you don't have enough potassium, you can't protect against the excess amount of calcium that builds up inside the cells. Berberine can help as an anticoagulant, so that can help reduce clotting. Number 2, and this is a well-known benefit, can decrease infectious diarrhea. So if you have an infection that's causing diarrhea, I would start taking berberine. All right, number 3, it can act as a natural antibiotic, okay, which actually explains number 2. It's also an immune stimulant. It can help boost your immune system. Number 5, anti-tumor, anti-cancer, big time. In fact, there's just a lot of studies going on using this berberine on tumors and cancer, which you don't hear about unless you actually dig in and find this data. Number 6, and this is actually a very important benefit, it has anti-diabetic properties. It can potently decrease your blood sugars. It can help with insulin resistance, making insulin and glucose more sensitive. So your blood sugars are going to be much better. There's been some reports that this will work just as good, if not better, than metformin. I realize I'm not making any claims. Check with your doctor before consuming this, but you may just want to read the research yourself. All right, number 7, it can help decrease the effects of caffeine. Caffeine can trigger arrhythmias. Well, berberine decreases the effect of caffeine. All right, number 8, it's anti-inflammatory. It's very, very effective for anything that has itis, bursitis, tendinitis, arthritis, and it's antiviral. Other than that, it probably doesn't work for anything else, and I'm being very, very sarcastic. This is the next turmeric. I think it's a very powerful phytonutrient that I think more people need to know about. All right, thanks for watching.
Berberine is this substance that comes from tree bark. I also learned about many years ago. And what's remarkable about berberine is that you can eat enormous quantities of food and not feel as if you've eaten enormous quantities of food. What are your thoughts on berberine as an alternative to metformin?
The thing with berberine, and we've studied it in my lab, it is effective at boosting energetics in the body, just like AMPK and metformin does. There are some human studies that exist, clinical trials showing that it increases insulin sensitivity.
Which is a good thing, right? No, but you want your cells to be insulin sensitive. You don't want a lot of blood sugar floating around that can't be sequestered into cells.
Exactly. So this is anti-type 2 diabetes. And so that this berberine does have wonderful effects on the metabolism, and in some clinical trials on dozens of people it's been tested.
Hi, I'm Dr. Meredith Warner, and I'm an orthopedic surgeon, and I want to talk to you today about berberine. Berberine is a natural way to increase AMPK in much the same way that metformin does. More and more studies were found looking at diabetics and noting that they had, the ones that were on metformin did better in every parameter. So they had less cancer, they had less heart disease, they lived longer, they had less arthritis, they had less pain, they generally felt better. So metformin was some kind of wonder drug that's just been under the radar for about 60 years. And then people started to figure it out. And it does this because it improves mitochondrial health, because it upregulates AMPK, so it's like a fasting mimicker, right? So if you calorie restrict, your AMPK is going to go up, and you're going to induce sirtuins and the cleanup processes of the cell and DNA repair and whatnot. Metformin does the same thing. Well, guess what else does it? Berberine. So this is a substance that is natural and is almost in its effects, almost identical to metformin. So berberine will lower your cholesterol, just like metformin has been shown to. That was reported in 1989 first, and then in 2004 it was shown in real life. It lowers your LDL levels. So why does everybody, the number one prescribed drug is statins, right? Berberine does the same thing. It lowers your total cholesterol, lowers your triglycerides. Guess what else lowers your triglycerides? Omega-3s. It activates AMPK, which means it's going to improve the bioenergetics of your cell, and then by virtue of activating AMPK, it's going to activate the sirtuins, which are going to help with the DNA repair and DNA methylation or deacetylation, and it's just going to make everything work better for you. And then, of course, because it's acting like metformin, it's going to lower your serum glucose. So it improves your insulin sensitivity. So like people in PCOS, things like that, where they have insulin resistance, or people with straight up insulin resistance, berberine is probably a good product to start with. And so because of all that, of course, it's going to help with weight loss. So I've actually prescribed metformin, and I've tried to prescribe other drugs like the GLP-1 inhibitors or Ozempic, things like that, to help people with weight loss. Because if you can just get your body into that stress state, or pull the glucose out of the blood and get it in the cell and start getting it to be used, as opposed to going to forming fat, people will lose weight. So a lot of work is being done looking at berberine as a weight loss supplement. But of course, you can't sit on your couch and eat Cheetos till midnight, wake up at 6 and not exercise, and then expect to lose weight just because you take berberine. It works better with a good circadian rhythm, a better diet, and a little bit of exercise, obviously. But guess what? Every single drug that's approved on the market for weight loss, the labeling always says with a good diet and with exercise. So I love berberine. I think it's great. You do want to start off slow with it and probably talk to your physician, because some people, it really controls blood glucose so much that it just makes them, they have to get used to that. So it is a potential diabetes treatment. There is a 2014 study looking at it for that reason. A lot of people will take it after a meal, particularly a meal that they know will spike their glucose. And again, when I say a lot of people, I'm talking about people heavy into wellness and anti-aging. Essentially it's comparable to metformin. So berberine is a great longevity molecule because